Hello, friends. Today's conversation is about learning how to determine the amount of water we need to consume during the day. Many people know it's necessary to drink 8 glasses of water daily, but no one knows where this formula came from and whether it has any scientific basis. The point is that we're all different, and our need for water depends on the conditions in which we live. Therefore, focusing on a specific amount, for example 8 glasses or 2 liters of water daily, is not reasonable. For example, water consumption can be affected by factors such as a person's gender, height, weight, intensity of physical work, the climate in which he lives, and his physical condition. For example, whether they're sick or have chronic diarrhea. So many factors can affect our water needs. It's essential to know where our body water comes from and how it's excreted to determine our individual water needs. 20% of our body water comes from food and 80% from liquids. These fluids can be anything from plain water to tea and coffee. Contrary to popular belief that caffeine-containing products contribute to dehydration. Recently, studies have shown that this is not true, and in principle, even caffeine-containing drinks can serve as a good source of water replenishment in our bodies. Of course, beer can also serve as a source of water replenishment in the body, but given that it carries an unfavorable alcohol load, we will not consider it a means of hydration here. It is believed that if we drink water, about 1 liter is assimilated in 1 hour. So, how is water excreted from our body? The first is using the skin. It can evaporate without producing sweat, or it is possible to sweat and release large amounts of water. In addition, water is released by breathing. The third route of excretion is urine. It's clear here. Healthy kidneys can compensate for up to 80% of the incoming fluid in 1 hour. And finally, a small amount can be excreted with feces through the gastrointestinal tract. Sweating here is the most variable way of excretion of water. That is, if a person lives in the north and is cold, he is unlikely to sweat. And quite the opposite if we're talking about people who live in southern countries or who work in production associated with elevated temperatures, or athletes who train for endurance and who can lose 2 to 4 liters of sweat per hour. The regulation of water balance in our body is mainly carried out by 2 hormones. These are vasopressin, or antidiuretic hormone, and aldosterone. Vasopressin is produced in the posterior lobe of the pituitary gland, and it is released in response to changes in the concentration of salts in our blood. The hypothalamus has special sensors that catch the salt concentration in our blood. If the salt concentration increases, the body perceives this as a lack of fluid. Immediately, vasopressin levels increase. Vasopressin acts on the kidneys, and they draw more water from the urine. It makes the urine more concentrated. Hypothalamic sensors saturate it with metabolic products, and the excess water is absorbed back into the body. The second mechanism of water balance regulation is sympathetic nervous system activation. It is the system that produces adrenaline and noradrenaline. As soon as there is an increase in the concentration of salts in our body, the sympathetic nervous system is immediately activated. It leads to the salivary glands ceasing to produce liquid secretion. Saliva becomes viscous, and the mouth dries up, stimulating our drinking behavior. The third mechanism is that when the level of circulating fluid decreases, our blood pressure drops a bit. As the pressure drops, the sensors located on the vessels, particularly on the carotid arteries and the aortic arch, send signals that increase the production of angiotensin II. It is the kind of enzyme that activates the production of aldosterone. This hormone retains sodium in our body, and sodium is followed by water secondary to water. Stimulation of the thirst center is another way by which water absorption is activated. During thirst stimulation, we get a signal in the brain that we're thirsty. In most people, these mechanisms of water balance regulation are enough to avoid dehydration. In other words, do not lose water and do not drink it in excess. For those who do not rely on their feelings of thirst, a very objective method exists to determine whether you have enough water in your body. The first thing to look for is the color of the urine. The typical color of urine in a person with sufficient water intake is light yellow. If the urine is darker, it is a sign of insufficient water in the body. It means the urine is concentrated, and it is time to drink water even if you don't feel thirsty. The second way to determine whether you need water is to drink 0.7 liters on an empty stomach. If a person's body is not dehydrated, the urge to urinate should follow after 30 to 40 minutes. If such a call does not occur, if the urine is not released, your body is dehydrated and you need to drink water. These rules are universal and very simple. Therefore, use them for your health. They do not require a visit to the laboratory, and you can easily apply them at home. The risk of dehydration, in other words, a decrease in the water in the body, is mainly present in sick people, such as children with vomiting, diarrhea, infectious patients, and patients with fever, because you need to drink more for thermoregulation. The risk of dehydration exists in older people. They have mechanisms of regulation of water balance that are disturbed. They may not feel thirsty, even though the body is dehydrated. Sick and old people require compulsory measures to hydrate the body. In this case, drinking 8 glasses of water every day is an efficient rule. You will definitely not lose out. Water intoxication is very rare. It does not occur in healthy people. It only occurs in people with kidney, liver, and heart failure. Usually, these people know about their illnesses and are under medical supervision. So my recommendations do not apply to them. Athletes have a high risk of developing dehydration during long events, such as marathons, triathlons, or bike races, over many hours of intense activity. Sometimes, the human body can lose 2 to 4 liters of water per hour with sweat in hot climates, while we can only assimilate 1 liter per hour. Here, we see an immediate imbalance. No matter how much we drink, we will not absorb more than 1 liter per hour, but the body can sweat so much that we will excrete 2 or 3 liters. That's the first side of the coin. The second side of the coin is that when you sweat a lot, you lose sodium with the sweat. 1 liter of sweat contains approximately 2 grams of sodium. It is easy to calculate that if we sweat, for example, 1 liter of perspiration per hour, we will lose 2 grams of sodium every hour. For example, cycling for 5 hours in a competition and you're already minus 10 grams of sodium. Therefore, endurance athletes should drink specific saline solutions or isotonic if training lasts for more than 1 hour. There's another category of people who need to monitor water intake. They are people with excess body weight and those who want to lose weight. The fact is that our body sometimes does not understand. It wants to drink or to eat. And so it is helpful for such people to drink a glass or 2 of water each time they want to eat something. It often helps to avoid unnecessary eating. The second trick that makes it easy for people to lose a few pounds without effort is drinking 2 glasses of water before every meal. The explanation is simple. The stomach will fill less. If you drink 2 glasses of water and it is half a liter in the stomach, you can no more stuff a lot of food inside. Therefore, this food replacement with water is beneficial for weight loss. There are people who effortlessly, for several months, achieved weight loss up to 10 kilograms with the help of water, without changing their eating habits. To summarize, I will add, healthy people, focus simply on your sense of thirst. Be sure to look at the color of your urine and do not allow it to be dark. There are no upper or lower limits on water consumption. Orient yourself to the signs I've told you about, and if you're feeling good, your body is fine. Thank you so much for watching to the end. Stay healthy. Always for you, Dr. PopMed.